Currently in Uganda, we get 130,000 new infections every year. To add on to this 1.2 million, but we lose only 70. And so those are the three rates they can talk about. So sometimes they can talk about a prevalence rate that is increasing, simply meaning there are new infections going in and lesser deaths. And we are getting lesser deaths in HIV because of treatment and so on. Actually, it's TB that is even increasing in our deaths because TB has also got complicated. Then you go to specific HIV transmission issues like mother-to-child transmission of HIV. In Uganda, and as you know, Uganda is the country with the highest fertility rates, amongst the highest fertility rates in the world. Uganda, for that matter, gets 1.2 million in pregnancies everywhere, almost third, fourth in the whole world. Out of those with an HIV prevalence of about 6.5, we get between 90 and 100,000 women positive and pregnant every year. And in those, we get about 30,000 new infections from the mothers to their babies alone. But over the years, we have managed to reduce HIV transmissions from, say, 22% 10 years ago to about 5%. So the HIV transmission rate from mother to child has reduced. But the HIV transmission heterosexually in adult men has gone up. So,
okay, let me ask you about the controversy that has been brewing all over the world,
yeah.
Which I think is also indicative of what is going on in Uganda. When you go to test for HIV in a clinic, what is it you're actually testing for?
We test for antibodies.
Okay, you are testing for antibodies to what?
To HIV.
Right. Why? Why can't you test for HIV?
Because of the cost.
The cost?
Because of the cost and the equipment. Yeah, in the country we can still test for real HIV, but maybe in something like 4 or 5 labs only. It's the cost, it's the technology.
Okay, what equipment would you require to tell me that I'm actually HIV, not antibody positive?
No, that is science. In immune response,
yes.
The body reacts by creating
producing antibodies.
And it's a normal scientific test.
But the antibodies have to be specific to the particular infection.
Of course.
So how do you know that those antibodies are specific to HIV?
Because the test is an antibody test specific for HIV. It is a special test. And syphilis is also antibody test but specific. Typhoid is also antibody but specific.
Which test is specific for antibodies to HIV?
There are several. We have I think about 17 of them, but the one we use in Uganda is the most famous one, Abbott determine.
Yes.
And it's also there are 3 of them. We do it 3 times before we tell you that you are really positive. Yes. So we have a screening one designed scientifically to screen, and if it's designed to screen negative, highly sensitive for negativity.
Yes.
But if it says it is positive, we confirm it.
You confirm it.
Confirm it with, in Uganda we are using StatPack.
Yes.
Yeah, we are using StatPack.
So StatPack is supposed to confirm the first test?
Yes, if it is positive.
If it is positive.
If the test reads negative, you don't confirm anything.
Why?
That is how the science is.
Okay, what about if the first one disagrees with the second one? If the first test was positive and the second test was negative,
we do a third one.
You do a third one?
Yeah, we call it a tiebreaker.
A tiebreaker?
Yeah.
Okay, so that tiebreaker is more accurate than the first 2?
Yes, it has the capacity to handle what number 1 and number 2 did not handle.
So why don't we use number 3 in the first place?
No, because the first one is highly sensitive for negativity. It is a screening test. It's meant to screen out the negatives out. So and that's what is common. So it's designed to test mainly for negative. So if it tests positive, then you are like, we must confirm this. So you confirm. If it is not agreeing very well, we do a third test. If the third test is also confusing, we usually say come again. or if they don't come again, we use another set of test kits.
That is, if you say come again, that's what you'd call indeterminate?
Indeterminate, or maybe you're an incubation period.
Yes.
Yeah.
What is the specificity of all the 3 tests you've mentioned?
All of them above 99. If it is sensitivity, it is 99 to 100. If it is specificity, it is 99 to 100. If you look at the specs of our tests.
Yes.
Yeah.
If it was 99%,
Yeah.
it means out of every 100, one person is false positive.
Yeah, possible.
Out of every 1,000.
Yeah, but it is not even 19, it is 99 point something.
Okay.
Yeah.
Now, I have looked at those stat packs,
Yeah.
at those inserts that come with these tests, and they write that they shouldn't be used for laboratory diagnostics, not to confirm the presence or absence of HIV or antibodies against it. So that eliminates all these tests.
No, they are designed for that.
But they write on the insert that comes with these tests that it should be used, it should not be used to test or to tell somebody that they are HIV positive.
They are meant to do what then?
I'm asking you, you are the head of the program.
No, then we would not be using them. They would not be using them. We would not be using them.
I have a very old copy of this.
Don't bring a very old one. We have improved.
Well, you can bring a new one. But on here,
that what is not intended. This is not what we use. This is not what we are using.
This is the PCR. You are using the PCR.
Okay. No, we are not using. This is PCR viral load. We are not using this. We are doing purely antibody tests.
But you are using a viral load.
No, we are not.
You are not using the PCR?
No, we don't use PCR. We use PCR for actually identifying the virus itself.
Yes.
Yeah.
But the PCR
and we use it confirm.
It says there that at the moment there is not standard test for testing the presence or absence of antibodies to HIV 1 or 2 in human blood. It's at the back.
No, it is there. This is old stuff.
This there.
It's there. It's there. I don't know where you got this from. These are very old things.
Well, I've got new ones from Kampala International Clinic, the 3 packs, and all of them say almost the same
This
thing.
is old stuff. Let me tell you.
Yes.
When they had just made these tests, for example.
Yeah.
Like there was a time you could get a determined test, and people claim that if you put it in the car, it would eventually test positive.
Yes.
Then they went back to laboratories and corrected these things. These tests are highly technical, and they
Have
really
you
take
got
time.
an insert that comes with these tests? With the tests that you use now?
We do.
And you are sure they don't say that it should not be used for laboratory?
No.
It should only...
Let me tell you, WHO would not be here, and CDC, who are in countries guarding against these things, they would not. We used to have a lot of problems with temperatures with some of these tests,
yes.
and they all went back to the laboratory for standardization.
Who went back?
WHO.
Is there a standard test for HIV?
Yes.
Is there gold standard?
Yes. Why, by the way, is this the reason for this interview? You didn't even tell me why we are conducting this interview.
The interview is
because this is not information. Even if we wanted to argue about this is not information for the public. It is not.
Why?
It is not.
Why?
What will it help? So that they don't go to test?
No,
and that's my fault.
Do you want your people to get an accurate test?
But do you now argue with them and say the tests are not correct?
No, I have looked at the inserts that come with all these tests.
Yeah.
I went to Kampala International Clinic.
Yes.
I spoke to the head.
Okay, so if you want to discuss the details of this, you go to the laboratory chairperson.
There's the laboratory chairperson?
Next door.
Okay. That's nice.
Yeah. Because you know what, that's the problem with you media. You want to look for the negative things, and that's what you give. No. For example, let me tell you.
Yes.
We know, like when we have run this test, the lab people know that if you test and the first person is positive, please switch off. We are now just discussing. Switch off.
Yeah, okay.
They know how to suspect. These kids can get spoiled, especially in the African setting.
Yes.
But we know how to suspect. So you're not going to tell the community. Of course, when we are counseling them one by one, we say, please make sure that these are really your tests. But that's not for camera. An argument of this not for the camera. So if you want to argue about this, go either to I don't know where you go to your smaller paper. Go now to the lab people. Go to WHO. Go to CDC. Because for me,
yes,
I'm a programs person. My work is to encourage testing, to tell people that it's good to go and test. It is the tests are accurate and tests are accurate.
The man who is credited for discovering HIV virus, Lac Montagnier, has said on camera that HIV alone is not sufficient to cause AIDS.
You want to go back to those things? Then you go and read the Florence Conference in 2002. Which eventually worked against
2002?
Yeah.
No, he said it in 2009.
No.
In California.
No. We
And Sanusi was
let
here.
me tell you,
Yes.
for us that is irrelevant. What is important for us is that we have HIV in the country and people are getting it and dying. Whether it was produced in a laboratory, as the one time said, don't go and do what the South Africans did. And people now they are the country with the highest number of people with HIV because they were told that no, don't accept that HIV causes AIDS. What have they benefited? What did they benefit? By
But is that not science? Are you arguing against science? Science has to be based on something that is provable,
yes,
that can be replicated elsewhere.
Yes.
What South Africa was saying?
What was South Africa saying?
What South Africa was saying is that there is no sufficient evidence that HIV causes AIDS, and that the conditions that we see in Africa can be called AIDS cases.
Yes.
Don't forget that.
So what has changed?
No, wait. The Bangui Declaration, the Bangui Conference of '86.
Yes.
Said you didn't need a test in Africa. You just need to look at the person.
Yes.
And if they have reduced weight, if they've got some diarrhea and some persistent fever, you can call them an AIDS case.
Yes. It was true. It sufficed.
But
there was not a single person who was different.
But sister,
that was good enough.
Can you show me a study that has been carried out anywhere that says that HIV as it exists, HIV 1 or 2, as discovered by Garo and Lac Montagnier, is sufficient to cause AIDS?
So if you want to do that, you go and ask our epicenters. Go and ask WHO Geneva. Go and ask the whole world. Go and ask. I don't want. It doesn't help us. That's exactly what South Africa thought they would do. What was that man say? Mbeki thought he would be the first person.
They removed him as the president.
But what did and he's made South Africans suffer. He should pay for that.
How?
He should pay for that.
How have they suffered?
Because they're hosting the highest population with HIV now in the world. Given that he thought something new would come, why those 5 professors of his from Germany and so on, what have they offered as the cause of the disease his people have? What have they offered?
One of them, Kerry Morris, discovered the PCR. He won the Nobel Peace Prize for Science.
Yes.
And the same PCR.
No, forget about PCR. People don't eat PCR. Those 10 million South Africans, what have those professors that said HIV does not cause AIDS, what else have they offered them as a cause of their sickness?
Isn't this science? Science should be, if it doesn't cause, let us look for what causes it.
Yes, tell us. What have they offered him?
So, do you know, for example, are you aware?
What have they offered him?
Are you aware that the test you use in this country to tell my mother or my father, and I've lost 6 members of my family through AIDS, but it is banned in Germany? The same test, the rapid test you are using in Uganda is banned in Germany. Germany, the whole government does not use a rapid test.
People don't take treatment the way we are taking here. You can't compare. Germany is using a lot of traditional medicine. Are we using it here?
Germany is not using a lot of traditional medicine.
Go and check.
I have lived there.
Yes. Germans use a lot of traditional medicine.
No, they use homeopathy.
Whatever it is. I worked with a German here. He got a happy zoster.
Yes.
We tried to treat the man here. He refused. He left the country.
Because we are going to treat him with chemotherapies.
No.
That's what your ARVs are?
No, we were going to give him the medicine that has come from their countries.
Which medicine would that be? ARVs are chemotherapies.
No.
They all came out of the failed cancer in America. They are chemotherapies. And chemotherapy is supposed to be administered.
ARVs?
Yes, all the ARVs, AZT.
Do you know that the first ARV case was in 1930?
In 1930?
Yes.
ARV.
Do you know that the first ARV was produced in 1930?
You can tell me about it. I don't know. And
So
that's
I
why I
don't
came
know
to.
what your agenda is. So I'm going to abandon this discussion. I thought you had come to talk about the World AIDS Day, which is coming, and these useless arguments I don't want.
Sister.
You're wasting, and that is my mistake. I should have asked you even why you're coming.
Yeah, but
I thought you were coming.
You seem to
okay.
be...
No, if you want to argue about science,
yes,
go to World Health Organization.
No, you said there was a laboratory person here.
I don't know. He's the chairman. Go and ask him if he accepts.
He's the chairman
of laboratory. If he accepts, talk to you.
What is his name?
You across the next door, they'll tell you chairman of laboratory work.
So your campaign doesn't brook any argument
about what?
It doesn't brook any discussion. It's like your case is closed. Nobody can question you about it.
The argument doesn't help. It will not stop any HIV.
You are testing for antibodies.
Yes.
Antibodies.
Yes.
The World Health Organization itself, I can show you this on interview, has produced almost 60 other conditions that will give a false positive in those antibody tests.
Why do you go for those minor? Do you think that the test we have chosen to do here is ours? We never choose a test.
Why shouldn't it be yours? Are you not a scientist? Didn't you go to school like everybody else is? Why don't you look at these tests yourself and critically examine them and determine and say, you know,
use of World Health Organization. Studies have been these have been standardized.
Like which study?
Like WHO.
There is no standard test for HIV. It doesn't exist. I give you 10 cows if you can show it to me.
If it's not standardized, go and ask WHO Kampala and ask them why they authorized us to use
I can show you them on tape.
Yeah.
They are saying there's no standard. In fact, you can be HIV positive in Uganda and negative in America.
That's not my work. Science is not my work. My work is to turn science into policy.
But it has to be science before you turn it.
Yes. That's what I'm telling you.
But this is what I'm saying to you.
It has to be science either globally or locally. And usually when there's science out there, globally, we try to make a home adaptation if we can. But in a country that doesn't even have a single electronic microscope, what science are you talking about? There is science that we can domesticate at home and turn into policy. There is science out there that we just said this one is beyond us. Even if it is good for people, we shall not manage it at home at this point in time. And we don't even make programs out of them. There is science which is very good and very difficult, and we're like, you people, let us accept it even if it serves 1 or 2 people. But this argument...
A HIV diagnosis is almost a death sentence.
Why?
Because if
you go and pick people that have HIV, apply your own test, find them negative, and let us know.
Apply what test?
Whatever test. Yeah.
I have come to you.
So what do you want? So what is your message? What is your message then? Yes.
If I have concerns, instead of standing there and telling people, you know, I have these concerns, let me go to the highest authority. And you are the highest authority.
So if you are coming to inform me that the tests are not good, you have discovered out there, so bring evidence.
Yes.
Bring evidence that the people out there whom we have diagnosed HIV in do not have HIV. Bring me that evidence. Then I'll run back to my technical committee.
What about if I bring you evidence that the test you are carrying out, the people who issue that test kit write on that test kit that it should not be used.
It's okay. So you bring that evidence, then the technical committee that advised me that please, this is the best test for us in the country.
Yes.
Yeah, use this. That's okay.
That is fine.
Yeah, for me, my problem is for you to bring people whom we say have HIV, but according to your test do not have HIV. Then I go back.
No, I'm not a scientist.
No.
Me, I am a broadcaster.
Yeah, so if
I can only come to you.
If you're a broadcaster, you don't come to me with very obsolete paper like that I don't even know where the source of information is.
It is an insert that comes with a PCR.
So if no, go back and bring the whole original document. Let's know the source, how old it is.
Yes.
How old it is.
What about if you go on the internet and find the same document?
I don't want that. For me, I have a procedure in the country.
Yeah.
If somebody finds the science is wrong, bring enough evidence. I call my technical committee. They will check with CDC and WHO.
Yes.
We shall even make a global call.
Yes.
And we will
I have interviewed the CDC. In America, I have interviewed.
You have CDC Uganda.
Why can't we interview CDC in America? That's why the headquarters are.
Then what is this one here for? Do you downplay this one?
Of course.
Why?
Because those are their bosses. It's like me now meeting somebody in Mulago Hospital.
You want to see technology. CDC Uganda has got a table, has got has got a laboratory. So go.
They were sent here.
The argument of whether tests work or not is not my business. It's not my business.
That is very surprising.
That's not my business, especially with you.
Yeah.
We have been dealing with testing issues ourselves, but we don't do them on camera. We don't take them to the public, because now I'm beginning to understand what agenda you are driving. Because I had a different call yesterday. So if you have, go and bring good evidence on that, and first start with WHO. The country representative will call me and notify me. And it's not the role of media. It's not the role of media to propagate the negative aspects. Because all you are now trying to do is to let me to tell the country that the HIV tests they are doing are wrong. And if they are wrong, what is the alternative?
That is not my question, sister.
That's your question.
That is you to deal with it. No. You're supposed to give us exact science.
We don't give science on media. We don't give science on media.
The test that you have now, it writes on the insert that you have no right using that test to tell me that I'm HIV
I'm not
positive.
the one who chose that test. Go to WHO, Kampala, or CDC, Kampala, or WHO, Geneva.
I thought you were the Minister of Health of
They
Uganda.
are the ones who asked us. We don't deal with human beings as individuals.
Why? This is a Uganda. Are Uganda part of American Empire or whatever?
No.
We are an independent state.
Exactly. As an independent state, we do not wake up and start treating malaria the way we do. Because we are not producing any tablet. If people are fighting themselves and the UN says you can't, have you gone there to tell them that don't kill Libyans because these are your people?
I have, actually. Yeah. They had no business being in Libya, if you want me to tell you.
But no, are you leaving people to kill each other because they are the ones? Are people not intervening? So even in Uganda, we are a developing country. We don't make even the tablets that we make.
So your health policy, for example, towards AIDS is set by the World Health Organization?
That's not the same thing. There are things we can do. There are things we manage.
And the
there
test.
Are things, yes.
So the test comes.
Like I'm telling you, for highly technical things, we first depend on WHO and CDC. And they tell us that you people, the virus has mutated, and it has mutated like this. And we are like, then locally we can attempt with their help to check whether the Ugandan virus has also mutated or not. And if so, what are the implications? They tell us, you people, we've discovered a new drug. It has worked this way. And most of those studies are also done in Africa. So you're not going to say the test that is working in South Africa may not work here. If it doesn't, then it means that perhaps the subtypes they have there, and that's the science we have. But for you to stand up and say Uganda should be using a different test and not a test from
Sister, I didn't say that. Sister,
so
I'm your partner.
Wasting my time. You're wasting my time. I'm very busy. If you want to deal with yours,